Last but least, good morning. A bit over 8.5 years ago, the ugly gun ban, the magazine ban, and I all sunsetted on the same day. With an apparent new dawn in banning guns, I fear I'd be forced from my retirement, and here I am. Among all these familiar faces, but expressing views not necessarily shared by anyone on earth. I'm the contrarian here. To quote the most relevant Marx, whatever it is, I'm against it. Some of you may have traveled long distances to be here. I only needed a senior citizen Metro fare card to feel like a token today. Decades ago, the NRA opposed federal funding of research on firearms, at that time by the Department of Justice, with the goal of establishing a firearms policy on the grounds that, thanks to James Madison and the members of what was really our greatest generation, the federal government already had a firearms policy. A well-regulated militia being necessary to the security of a free state, the right of the people keeping bear arms shall not be infringed. We had no objection to research being done by those who wanted that policy changed. We just didn't think taxpayers should be funding that research. And we did some research ourselves. One of our earliest projects was a survey. It was useful then, and I think another one would be useful now, so let's formally list it as my top research priority. I'm not sure of my confidence in the ability to produce a survey that might be fair to both sides based on two experiences. First, after our 1978 survey was released about the same time as one from the other side, a vice president at Lou Harris's firm noted that both surveys were dismissed by some as biased and said the best way to find one that was accepted as valid by the public would be to have us work with Lou Harris. We said that was something worth pursuing. He pursued it with Lou Harris, who said something to the effect that he wouldn't have anything to do with the bastards who murdered his friend John Kennedy. Our other experience involved a federally funded survey with both sides to be represented in the development, oversight, and analysis. Gradually, those suspected of pro-gun sympathies were eased out. So I don't necessarily expect universal acceptance of any survey, but the idea of one or a few is appealing. And I'm not exactly sure how it would be done. It might involve focus groups, and I aim at both what we generally call law-abiding gun owners and those not so law-abiding. Indeed, it might involve various different surveys. What I'd find particularly interesting is spurred by the traditional public health goal of improving things without concern for what they call, when trying to curb motor vehicle morbidity and mortality, the nut behind the wheel. I recall when noisemakers were first used to encourage the nut behind the wheel to buckle up, about the first thing I did with my new car was to disengage the noisemaker. Public health professionals sometimes neglect that fact when something is changed. Others can actually adjust to it. How gun owners would respond could be significant, particularly in these days when 3D xerography could make it easy for ordinary citizens to make medium and large capacity magazines. My hope for a survey doesn't mean federal funds should be used. Decades ago, we figured there was plenty of non-governmental funding available. There should be even more now, even as now. There should be less governmental funding in these days of sequestration, concerns about deficits, to say nothing of Congress's suggestion that the CDC shouldn't be involved in gun control research. But for private funding, in addition to the Midwestern Focus Joyce Foundation, now we have such multi-billionaires as the three-term nanny of New York City and the morally and legally corrupt George Soros. When the CDC first decided to get involved in gun research, the NRA's next argument, not one I liked, let me hasten to note, was that such research was redundant since the Justice Department was already involved and crime control was the only politically effective justification for restrictive gun laws. Whatever public health folks might think, Americans aren't really concerned with the gun misuse in the small and diminishing number of what death certificates classify as accidents. And let's face it, we're not here because 20 white octogenarians realized the medical profession was better at keeping them alive than at keeping them well. And we're not even here because 20 young blacks were murdered in Chicago. A more serious objection in the 80s, 90s, and possibly now is that the CDC funding and research tend to be biased. There was never really any question about that. The CDC made it clear in advance that it was going to produce so much anti-gun research as to cause a tsunami in the way guns were viewed in America. But at least Mark Rosenberg, the anti-gunner in charge, really believed his science would change public perceptions and the policy recommendations would follow the research. That was then, this is now. In this case, the President of the United States first announced the gun reforms, say A through M, to be adopted, and then called on the CDC to conduct the research, presumably to support the policies. More recently, he's indicated that, prior to having research to support his policies, they should be passed based on emotionalizing the issue. That's not quite textbook epidemiology, and the question is how much research methods have improved. Problems with research past included acceptance of the argumentum ad hominem as a response to criticism and some actual dishonesty. This has led to me being put in the odd position of praising with faint damns. B is lots less dishonest than A or C. Sometimes misstatements might not have been totally false, but only half-truths, etc. Recently, for example, a researcher writing about a decades-old study asserted that he had collected all sorts of data, including ethnicity. Well, he had collected those data, but he expressly noted that he had chosen not to use them to test them as a possible factor associated with homicide. That was then. This is now. Times may have changed, although one thing I find interesting here is the extent to which this is old home week, meeting enemies and frenemies from decades ago. For some reason, the program reminded me of a statement by the esteemed Mr. Dooley from about a century ago. Many a man that couldn't direct you to the drugstore on the corner when he was 30 will get a respectful hearing when age has further impaired his mind. I don't know why I thought of that. I would have trusted almost all of you to direct me to the corner drugstore. And I have the hope that public health research on the firearms issue will have improved, but that's hope, not confidence. One issue for me here today is not just what you all should study, whoever funds it, but how you should study it. I'll recommend a couple of articles on how not to study it. First, there's a paper of mine published in Volume 1, Number 2 of Homicide Studies, 1997. Another good source is the more entertaining and vituperative criticism in an article by Don Cates et al. Called Guns and Public Health, Epidemic of Violence or Pandemic of Propaganda. I like the way the title takes the common media misuse of epidemic and adds the misuse of pandemic. The problem is that those articles are more of a critique of how the research was being done rather than advice on how to do it correctly. So once you read some criticisms, maybe you should just find a nice epidemiology textbook and follow its guidelines. I'd recommend something by Kenneth Rothman, at least that's whom an epidemiologist buddy referred me to for assistance in my responses to anti-gun public health articles. Some public health research on firearms has been fine, generally accurate descriptive information regarding gun-related or crime or other related bad things with various demographic data collected and analyzed. The research may have been flawed in singling out guns, but it didn't necessarily push any particular solution, at worst suggesting that something had to be done when that wasn't necessarily the case. From the point of view of policy making, the problem is that it's like lots of criminological and epidemiological research, requiring lots of similar studies in hopes eventually of inducing the nature of the problem and possible effective cures. The problem comes when a study merely measuring the issue concludes with a specific policy recommendation. A study is produced, say, with massive publicity about how bad it shows guns are, or some guns, or gun owners, and goes on to say this means some specific restrictions are good. When that happened in the past and I criticized this, the response was, hey, we told you so. It's in the list of caveats that this study is small scale, unrepresentative, quite possibly impossible to replicate, with all sorts of other generally accepted research limitations. Is it our fault we sent out a press release making it out to be definitive? Well, yes. In the case of guns and other issues, the emphasis on guns rather than the underlying problem, which is violence. That flaw not only sharply limits the usefulness of research measuring the problem, but helps to undermine, from my point of view, research measuring possible solutions. I think the social goal of gun control policies is to reduce the amount of violence, particularly death. A measure is improved effective by changing the types of guns being used, or the number of shots being fired, or the capacities of magazines, what guns are traced to where or how offensive guns were acquired, or even the use of guns in homicide, unless the rate of criminal violence, or at least criminal homicide, is reduced. For that matter, reducing the number of killings, if the lives saved are those of violent criminals, may not prove a social good. When it comes to research on the protective use of guns, but also to some other issues, I'm afraid much gun research is flawed by the belief that the only purpose of guns, or some sorts of guns, is to kill human beings. So self-defense hasn't occurred if the criminal isn't dead, and only deaths are compared. Usually, of course, this involves other sloppiness regarding the sorts of guns, the sorts of users, locations, demographics, etc. As a result, anytime you all come up with 6 or 18 or 43 or 102 or any other catchy ratio, it's meaningless. So recognizing that, following the science of epidemiology, public health research might be useful. What should be on the list of topics with higher priorities? Well, beyond some surveys already mentioned, I think the first thing might be to try to measure the impacts, if any, of existing regulations and possibly look at enforcement techniques. After all, given the proverbial 20,000 gun laws and the U.S. Code's insulation of most state gun laws from interstate leakage, effects in theory might be measured in some ways. Another study related to that might study how law enforcement agencies do or do not enforce the laws on the books at the federal, state, and local levels. For example, there's recently been debate over what happens when the instant background check causes the denial of a gun transfer. We all know that under the instant background check system, a lot more people are denied instant access to firearms than are prosecuted. So what does happen after denial? What do federal, state, and local authorities do or not do, and why? Why are there so few prosecutions? What sometimes may happen is that federal prosecution is skipped because state and local enforcement is taking care of someone with an outstanding warrant. Another possibility is innocent application. A prospective gun buyer tells the dealer he got into some trouble as a kid. He doesn't know if that's disqualifying. The dealer says, well, let's let the government decide. Or there might be disqualifiers of which the applicant is unaware. At any rate, there might be something gained from learning how the various governments interact regarding various gun laws and their possible violations. How do the various levels of government cooperate on gun law or other criminal law enforcement? Is the effectiveness or ineffectiveness of gun laws related to how they are enforced? Would changes improve the situation or simply lead to increasing the legal difficulties of persons who pose minimal threat to society, where they do or don't own guns, and whether they want to or don't want to own them? Not all of this will fit in nicely with nice massive data collection efforts. Some might involve switching surveys from the public at large to various small parts of the public. I did indicate my fondness for surveys, right? But in general, I'd say the areas and ways I'd be interested in criminologists and epidemiologists studying would be, first, survey research that indicates what's going on and would go on with gun owners and various regulatory changes. Second, studies of the effectiveness or impact of various regulatory changes already being experimented with at the state and local level. And third, studies of how various government agencies alone or in consultation use, enforce, ignore, whatever, current federal, state, and local laws and ordinances. I put this on a slide to you, but I'd hate to ruin a perfect record of never having used a slide in any presentation in my entire life. I did once use overheads. Those are now on consignment at an antique store. I'm just a wordy kind of guy. I yield the balance of my